Last, we invite Dr. Hitisha Mittal, she's there, for the presentation on rescuing conjunctival lymphatics from MMC-induced damage in rat model of glaucoma surgery.
Good afternoon, everyone. I'm Dr. Hitisha, and I'll be sharing our work on rescuing conjunctival lymphatics from Mitomycin C induced damage in rat model of glaucoma surgery. The draining vessels from the conjunctival blebs are damaged during glaucoma surgery due to inadvertent cutting of the vessels, due to usage of intraoperative cautery, and foremost by usage of mitomycin C intraoperatively. It not only damages the pre-existing channels but also prevents reformation of these channels post-operatively. A study published in 2021 used ocular surface lymphangiography in live humans and showed the presence of lymphatic channels in the subconjunctival space. Another study published in 2016, they saw the effect of mitomycin C on the density of blood and lymphatic channels in eyes with leaking blebs post-MMC trab, and they found that there was a significant reduction in the blood vessel and lymphatic vessel density in the MMC-treated eyes, suggesting its toxic effect on these draining channels. So this leads us to defective fluid removal from the subconjunctival space, eventually causing bleb failure. This led us to this question: can we induce lymphangiogenesis in the subconjunctival space, especially after MMC application? On further literature search, we came across retinoic acids, which have been evaluated in different studies of animal models for their lymphangiogenetic potential and saw that they have positive lymphangiogenic role. So we designed a study with the aim to see the effect of MMC application on the conjunctival lymphatics and to see the reversal of this MMC-induced inhibition of lymphatics by simultaneous application of retinoic acid. It was a prospective experimental interventional study done on 25 Sprague Dawley rats after appropriate ethical approval. We had 25 rats divided into 5 groups. The right eye in all the groups was the intervention eye and the left eye was control. We used a 30 gauge needle to induce subconjunctival injury in the right eye of all the rats, followed by a superior subconjunctival bleb formation according to each group specification. In group A, the bleb was formed using balanced salt solution. In group B, using mitomycin C. Group C, 100 nanomoles of the synthetic retinoic acid. Group D was the combined MMC and retinoic acid group. And group E was the dimethyl sulfoxide group, which is a diluent for the retinoic acid preparation. On post-operative day 14, the eyes were renucleated, the conjunctival specimens were excised and sent to pathology for staining with Mason trichome, CD31 and D240, which are the vascular and lymphatic endothelial markers respectively, and we aimed to see the fibrosis, lymphatic and vascular density in these channels. Now coming to the results, these are the histopathology slides of D240 stained specimens showing the lymphatic channels. The first image shows the normal conjunctival tissue and the arrows marked shows the lymphatic channels. The second one shows there's an increase in the number of lymphatic channels after a localized injury with balanced salt solution. The third image shows a decrease in the number of lymphatic channels when MMC was applied. And the fourth image shows a dramatic increase in the number of lymphatic channels when there was a combined usage of MMC and retinoic acid. This table highlights the fact that the mean lymphatic count was higher in the combined MMC and retinoic acid group as compared to the MMC group alone. The first graph shows the intra-group analysis between the intervention and control eye across all the groups. It shows that the MMC treated group had a lower lymphatic count in the intervention eye when compared to its control, and the combined MMC retinoic acid group had a significantly higher lymphatic count when compared to its control. Similarly, on intergroup analysis, we saw that the combined group had a higher lymphatic count compared to the group A and group B. So, MMC resulted in significant reduction in conjunctival lymphatic density. The 100 nanomole retinoic acid significantly increased the conjunctival lymphatic density not only when used alone, but also in the MMC treated eyes. So we conclude that synthetic retinoic acid prevents MMC-induced reduction of lymphatic vessel density in rat eyes, and it has potential application in preventing or reversing the MMC-induced complications in glaucoma surgery and thus improving our surgical outcomes. Thank you.
Thank you very much. And what was the time between the injection of the solution and the sacrifice of the animal?
So 14 days. There's a Singapore eye model for glaucoma surgery, and they have found that the post-op day 14 shows similar wound healing properties when we compare it with human studies. So that's why we chose post-op day 14.
So I think with this we come to the end of the session.
Thank you so much.
I'd like to thanks